Welcome back. In this section, we are going to be learning about the pulmonary circulation and some fetal changes in them. So as we said previously, when blood returns from the entire body, it is partially deoxygenated. And so this is all the systemic circulation returning back to the heart, and it's going to return to the right atrium. And there are three different structures that will empty blood into the right atrium. The first one is the superior vena cava, which empties all the blood coming from the head and the neck and the two upper extremities. So everything in the chest and higher enters the heart from the superior vena cava. Entering in the bottom part of the right atrium is the inferior vena cava. So all the blood from below the diaphragm, from your abdomen, your pelvis, and your extremities, all of that will enter the heart through the inferior vena cava. And the third opening is blood from the coronary sinus, which is a structure we'll learn about when we do circulation of the heart. And this blood is the deoxygenated blood from the heart muscle itself. And it also enters through the backside of the right atrium. So when blood enters the right atrium, it's going to go through the tricuspid valve into the right ventricle. And then when blood exits the right ventricle, it is going towards the lungs. So we are starting the pulmonary circulation. So from the right ventricle, there is going to be a valve called the pulmonary valve, and there's only one blood vessel. Even though we have two lungs, there's only one blood vessel that leaves each ventricle, and on the right side, that is known as the pulmonary trunk. So the pulmonary trunk ascends for a few inches, and then it will divide. And it will divide into a right pulmonary artery, which carries it to the right lung, and blood in the left pulmonary artery will be carried to the left lung. So blood goes to one or the other. It will not go to both. Once it's in the lungs, it goes through the capillaries where gas exchange will happen, and it'll pick up lots of oxygen. And then it will leave the lungs through either right pulmonary veins or left pulmonary veins. Okay. Now, whereas there's only one pulmonary artery that exits from the trunk going to each lung, there's actually two main pulmonary veins that drain each lung. And so this is why we're going to have four openings for pulmonary veins into the left atrium. So the other thing I want to point out is, even though we call it the pulmonary vein, it is always going to be red in your drawings and paintings and structures, because it is blood leaving the lungs, so it's oxygenated. But because it's going back towards the heart, it is a vein. So the pulmonary vein carries oxygenated blood just like the umbilical vein carries oxygenated blood. So these are exceptions you always need to keep in the back of your brains. Okay. So here's a picture of the heart reminding you arteries taking blood away from the chambers, veins bringing blood back towards the chambers. So now that we've covered all the structures, why don't you go through and see if you can name all the structures and follow the arrows for the path of blood flow through the heart, because that is something you will have to know. Okay. Now, in the fetus, before you were born, if you recall, you're not breathing because you're floating in fluid. All the oxygen's coming courtesy of mom. So we do not have to send blood to the lungs. And so there's a shortcut built in, and when blood enters the right chamber coming from the superior and inferior vena cava, the vast majority of it takes a shortcut through the interatrial septum, where there is this oval opening known as the foramen ovale. Okay. And it can be a small hole like this, but oftentimes it's kind of like a flap, and the pressures on the right side just push the flap open. But it's definitely an opening through which almost all the blood in the fetus is going from the right atrium directly over to the left atrium so it can go to the body of the baby, because there's no need to go to the lungs. There's no extra oxygen to pick up there. Now we do see the remnant of the foramen ovale as seen here in these two pictures. It can be oval shaped or it can be slightly rounder shaped. And in the adults, this is usually this shallow depression. So we call it a fossa ovalis, which means an oval shaped shallow depression. Now, here's the thing. Even though the blood is supposed to cut across from the right atrium to the left atrium, like this arrow is showing, some of it decides not to get into that line with all that other blood and goes, I'll take the scenic route. And so it goes down into the right ventricle. And from the right ventricle, it will go through the pulmonary valve into the pulmonary trunk. But you know what? Whoever designed you was still smarter than you, because it goes, I'm going to put in a second shortcut because you still don't need to go to the lungs. Okay? And so this second shortcut, whereas these are the pulmonary, right and left pulmonary arteries, right across from the pulmonary trunk, there actually is a connection between the pulmonary trunk and the distal part of the arch of the aorta. So blood can shoot right across into the aorta or between two arteries. And so this shortcut is called the ductus arteriosus, not to be confused with the ductus venosus, which was carrying blood from the umbilical vein to the inferior vena cava. That one's called venosus because it's two veins. This one's called arteriosus because it's two arteries. And we can see the remnant of the ductus arteriosus in every single person after birth, where we have this dense connective tissue connecting the two, and it is known as the ligamentum arteriosum. So just to review the prenatal blood flow, when blood enters the right atrium, whether from the superior vena cava, the opening of the coronary sinus, or the inferior vena cava, the vast majority of it will cross from the right atrium through the foramen ovale into the left atrium. Some of that blood will, however, go into the right ventricle. A small amount will go through the tricuspid valve into the right ventricle, and then it will exit and come out into the pulmonary trunk, wanting to go in the pulmonary arteries to the lungs, where still just a minuscule amount will go, but the vast majority will take that second shortcut, the ductus arteriosus, to show up at the distal part of the arch of the aorta and then travel in the thoracic aorta. So take a moment to review this, where you clearly can see the direction of flow going through the heart, as well as through the pulmonary trunk, and as well as through the aorta. Okay, and now that you've mastered that, or if you haven't mastered that, freeze the frame and then go back and put it in movement again, because now what I want you to do is put everything together that you have learned. All three of the fetal differences in circulation: the ductus venosus, the foramen ovale, and the ductus arteriosus, and understand the implications for oxygenation and degrees of oxygenation everywhere in the baby. All right. With that, I want to thank you, because we are done with this section, and I will see you again shortly as we continue our exploration of things related to the heart.